This is Aitana Hecht from DailyClout, and I'm here with Dr. McCullough, who's an internist and cardiologist. Thank you so much for being with us, Dr. McCullough.
Thanks for having me.
So, as I'm sure most of our audience is familiar with you, as you know, a longtime cardiologist and very, very published and respected medical physician, internist. Can you explain a little bit about how you kind of were made aware of all of the issues that are going on in the current medical system today?
You know, I was an academic professor of medicine at a major medical center, had a normal academic life, a blend of clinical care and academia, lectures, academic rounding, textbook editorship, journal editorship, grants, contracts, the typical academic life. And when COVID-19 hit, I redirected my efforts to learn how to treat the virus. And it was there in my attempts to treat my own patients and then help as many as possible that I ran into, for the first time, infringement. Infringement, what I mean is attempts at government agencies to try to actually block the delivery of healthcare and intentionally promote fear, suffering, hospitalization, and death. And when I raised issue to this in 2020, that's when it was game on.
And then they came after you. Is there any update you can give us on your board certification battle that you've been public about?
The American Board of Internal Medicine is attempting to strip me of 6 years of my life, my residency and my fellowship. They've gone through an accusation period about violation of a COVID misinformation policy, which didn't exist at the time I made the statements, to my response, to them dismissing all of my citations and then recommending decertification and now my legal appeal. So it's a long, drawn out, consumptive process. In short, I've been judged by a group of doctors, and not even my peers. They have no experience in COVID. They've never testified in the U.S. or state senates. They have no expertise. None of them have anywhere close to a fraction of my academic accomplishment. They have actually misinterpreted CDC statements, and I've said I've used correct CDC statements in this accusation rebuttal process. Now I'm formally appealing. And my greatest shock in investigating this is the American Board of Internal Medicine is directly colluding with Weber Shandwick and Blackbird AI, and they are receiving their funding and contracting through Pfizer and Moderna. So it's Weber Shandwick that actually has an embedded marketing unit in the CDC, discovered by Senator Rand Paul, who's now sent a disciplinary letter to Rochelle Lewinsky at the CDC. It's Weber Shandwick that's co-presenting at the South by Southwest conference with the American Board of Internal Medicine and Blackbird AI. So we have a situation here where the American Board of Internal Medicine has lost all credibility as an independent, fair, balanced organization. And if indeed I'm completely stripped, it'll fundamentally terminate my career. I won't be able to contract with insurance companies. Won't have hospital privileges. Won't be able to. I'll be entered in the National Practitioner Database, and at that point in time, I'll have to launch a lawsuit that would involve antitrust and a whole variety of violations.
Well, that's certainly very disturbing, and I hope it doesn't reach that point. But it seems like we're going in some sort of direction where the American Board of Medicine is just the latest in a long line of institutions that have lost the trust of the American people. And I mean, just as much as the people have lost trust in the institutions, that means that they gain trust in those that the institutions, disparage and want to kick out. So it seems like we're almost heading towards two separate medical systems, one where the patients and the doctors still operate within the system, and one where they work outside the system. And it seems to me like the people working outside the system are beginning to approach health in a very different way than we've been used to for the past few decades.
They are. I took a position as the chief scientific officer of the Wellness Company, which is now an alternative medicine access point for Americans right now. Hopefully will extend to Canada shortly. But this involves access to health and wellness, a cell phone app, 24/7 doctors, pharmacists, nurses, and others, independent pharmacies. It's a way of breaking through this grip that the biopharmaceutical complex has over healthcare at this point in time. And what people are finding out is that a cash-based system is far more affordable than our insurance-based captured system at this point in time. So I think we will run two parallel systems. It's interesting. Our CDC says that only 17% of people have taken a vaccine. That's what the CDC says. But, you know, there are now two surveys, one by Rasmussen Reports and the other one by Zogby, that representative U.S. surveys that say a third of Americans haven't taken the vaccine. And the vaccine seems to be a dividing line. Americans who haven't taken the vaccine now, they're not going to start taking the vaccine. They're not developing more trust. They've lost their trust. In fact, every time someone mentions a vaccine to them, they want to run the other way. That seems to be the dividing line. So there'll be patients who are unvaccinated that will go to independent providers. They'll pay premium for this. It'll be a cash-based system. And then you have everybody else. And everybody else is heading down the road of accelerated atherosclerotic cardiovascular disease, blood clots, myocarditis, neurodegenerative diseases. It looks pretty grim on the other side.
I mean, it really does. I was listening to Dr. Kelly the other day, and she mentioned that we have disease care in the U.S., not health care. And I think what the Wellness Center is doing and what you're doing is, you know, trying to pave that road towards a true healthcare system.
We're trying, you know, there still clearly are needs for prescription medications. You know, about 97% of what I prescribe in my practice is affordable generic medicines that are $3 to $9. So, you know, so many problems can be handled very affordably. There will be a need for high-tech cancer care, high-tech surgical care. I mean, there are some things that are just absolutely wonderful in medicine. So we'll need a blend. But you can see at this point in time, patients have had enough. I've had patients told they can't have a surgery unless they take a vaccine. They can't have an organ transplant unless they take a vaccine. And then the vaccine makes them sicker and many times makes them ineligible for the procedure. This is turning out to be a disaster, and it's all on the failed COVID-19 vaccines.
Yes. Where do you see that breaking point coming? I mean, I feel like so many people who've been in this fight have been saying, oh, it's just around the corner. And it really truly feels like it is, because it feels like a lot of things are crashing down at once. But where's that inflection point?
On June 11th of 2022, the World Council for Health issued a pharmacovigilance report calling for all the vaccines to be removed off the market. I reiterated that on June 27, 2022 in the Texas Senate, and on December 7th, 2022 in the U.S. Senate. So we've had broad calls now for the vaccines to come off the market. Those calls are not going to reverse. It's not like some new information is going to come in to have us reverse that call. Andrew Brigden in the UK Parliament issued a formal call. So did Malcolm Roberts in Australia, Christine Anderson in Germany, in the EU. So these calls for market removal will only intensify. They're not going to go backwards now. And, you know, from a purely a data safety monitoring perspective, the vaccine should have been pulled off the market February 1st of 2021. So unfortunately, far too many people have taken a vaccine, and it's far too late. But these formal calls now in formal sessions in Senate and Parliament cannot be reversed. They're in the National Archives. It's permanent at this point in time.
They can't be reversed, but it seems to be like the health agencies and the pharmaceutical companies are ignoring them repeatedly, even as they grow and even as we see fallout.
Well, I can tell you the Senate and the House are not. And we know that that now the appropriation that came over to the military has forced the military to drop the vaccines. Next step is for the military to restore everyone's positions and pay. We're seeing mandates being dropped across universities. Recently, Tufts University, multiple corporate mandates. So our work really has paid off, but the threat won't be gone until the vaccines are off the market.
Yeah, for sure. I saw on your, can you tell us a little about your Courageous Discourse Substack and how you got started there?
Courageous Discourse is a very popular Substack. I read it with best-selling author John Leake, who's a true crime author. So it blends across developments in COVID-19 as well as important new developments in culture, sociology, and particularly with respect to civil liberties. And I do graphical abstracts. They're very brief, but give people a critical update on the science of COVID-19. The graphics are so good. Many people want to subscribe and just use the figures, which they're free to do. It's republished almost every day on Trial Site News, republished very frequently on Epoch Times and LifeSite News. And, we found Substack to be an incredible platform for free speech. And, I went to Substack when I was temporarily suspended from Twitter. I had one of the top Twitter doctor accounts. I think as a practicing doctor, I think I was number one. And, I can tell you, I was suspended for 2 months for no reason. I did have a issue number assigned to my case, and then I was restored. There was a vote on Twitter. Thousands of patients. I was trending on Twitter without even tweeting. I was trending, and the vote was 98-2. Get Dr. McCullough back on Twitter. That was better than Trump or any other political person. And I can tell you, Twitter was running unfollow programs on me, shadow banning, and they were running blacklisting programs on me, trying to mute my message. I can't tell you that I'm completely free of this. Twitter has not said that they've gotten rid of the FBI agents out of the Twitter offices. But we know what was going on is Twitter was a state actor, and who was really driving the ship was the U.S. intelligence community. The U.S. intelligence community community clearly had a plan to suppress any advances on treatment, inpatient or outpatient, give anybody any hope and any information on vaccine safety in order to railroad the vaccines on the world. And it's a U.S. intelligence community operation, FBI and others.
Well, it worked because there are still those, who call themselves doctors who disparage you and try to write you off, which obviously anybody who pays attention to you knows is, quite.
But let me address that. Listen,
yes,
I've given grand rounds in every major institution in the United States. I've had the lead paper in the American Journal of Medicine now twice, published in New England Journal of Medicine, Lancet. Was the editor of 2 major journals. I was an endowed named visiting lecturer at Harvard in 2018. I can tell you, since the onset of the pandemic, I haven't had a single doctor at my level. We're talking a chief of medicine, a division chief, someone with over 500 publications in the National Library of Medicine. I haven't had anybody at my level challenge or dispute anything I've said.
Nope.
None.
They just managed to call you names without having to address.
No, they don't. No, people at that level.
People at that level, they just stay silent.
People at that level stay silent. The only detractors I've seen are anonymous fact checkers that trace back to what we call the biopharmaceutical complex. They trace back to this complex of public-private entities that are trying to drive mass vaccination. Now, the methods that they use are simply to make false counterclaims. So they don't publish. They're not involved in the peer-reviewed literature. They simply are making false counterclaims. And this is when we find organization after organization. One has been the Annenberg Institute on the East Coast. Another one's been a PolitiFact and FullFact, the Pointer Institute, which traces back to the Gates Foundation, teamhalo.org, that traces back to World Health Organization. So these are easy to track. Most of them they look like they're uncredentialed or lightly credentialed graduate students who are probably moonlighting on the internet, trying to put out false statements. Many times the comments on Twitter are vulgar and they are ad hominem attacks. And so they quickly get blocked off all the feeds and they probably just repopulate more accounts. So it's a war of information. But let me be clear. I have over 500 citations in the National Library of Medicine. There's a few doctors ahead of me, but nobody at my age for sure. There's never been someone at my standing, either by email, text, or phone call, who has ever disagreed with me. And we've had multiple open sessions at the U.S. Senate. The last one was December 7th, 2022. We invited all the public health figures that you're aware of and more. We had plenty of seats for them in the Kennedy caucus room in the Russell building of the U.S. Senate. Many of them are right there in Washington. They could have easily come over and attended, and they could have defended the vaccines. No doctor of any academic standing has ever publicly defended the vaccines in a roundtable environment.
And yet they're still trying to strip you of your certifications. It just defies common logic. It's very frustrating to witness, and I'm sure way more frustrating to experience. Just jumping back to the subject of Substack and Twitter, I just want to note how incredible and really miraculous it is that in this kind of propaganda and information war, like you mentioned, we as people do have the ability to communicate and share information at a speed that could never have been imagined. And the truth is that the CDC, the FDA, on some level, it feels like they were not prepared for the people to be able to unite. Organizations have sprung up in the last 3 years for all sorts of health freedom and medical freedom. I mean, the people led by you really primarily have really stood up to meet the moment. And I just want to make note of that. Without that, we would not have had a chance.
Well, since this is the DailyClout, I do have to remark, I'm a political moderate. In fact, I tend to be a bit left-leaning. And I think it's remarkable how Naomi Wolf, who I used to watch on CNN, is teaming up with Steve Bannon, former Breitbart, and now on the War Room. In fact, I've gotten to know Bannon personally, and I've been on his show, and I have tremendous respect for him, tremendous respect for Dr. Wolf, and how there's no more right and there's no more left. People are coming together. It's either about civil liberties, medical freedom, personal autonomy, about scientific truth, or it's about this false government narrative, which is anchored in chronic fear and subjugation, threat of reprisal, repeated vaccination shots of genetic vaccines which don't get out of the body, which cause disease, and then this marching forward, which looks like it towards a new world order. We're hearing about the World Health Organization now bypassing all different types of votes to try to get things to where they have some type of authority. This is going to be a showdown of, does the World Health Organization, the World Economic Forum, does this complex, do they really have authority over us, or are we going to break free? It's all in the context of this, quote, health emergency. Let me tell you, I'm a doctor. I take care of COVID patients. I know the disease inside out, backwards and forwards. I know all the faces of it and the vaccines. There has not been a health emergency since January of 2021. The health emergency should have been declared closed. We have one declared at the level of the president and one by the Secretary of Health and Human Services. They should have been ended in January of 2021. All the state emergencies should have been dropped. That means the emergency use authorization mechanism should have been dropped. So if I was running the White House or HHS or Surgeon General, I would have worked to close all of these. Closing the emergencies, ending them, is a very important step forward. We're 3 years into this. People look around, they see busy restaurants, busy airplanes. No one feels we're under a health emergency, yet President Biden and HHS Secretary Becerra, they have us under two emergencies, SARS-CoV-2 and monkeypox. And no one, listen, I go out in life. I was out today in public life. No one has ever come up to me expressing concern over the current monkeypox emergency. No one.
It seems like we have a group of people who are, who seek freedom and value individual liberties, and a group of people who are loyal to a system. And that system, whatever it entails, can do no wrong in their eyes. And it's extremely hard to extract yourself and to extract other people from being loyal to this system for some reason. It's, you know, it's interesting to draw certain parallels in history just of watching people be loyal to a system instead of individuals. But it's certainly remarkable, and I really appreciate you taking the time to speak with us and share your thoughts. And thank you so much. Where can anybody find you and your work now that Twitter's back?
Be sure to drop into my website, petermcculloughmd.com. That'll give you like links to everywhere on social media. Courageous Discourse, Substack, for sure. Have to subscribe there. Check out my podcast, radio, twice on Saturday, twice on Sunday, America Out Loud Talk Radio, McCullough Report. Then it hits the podcast circuit through the weekday. Very, very popular now, probably the most popular podcasts out there, done by a medical physician. My book, Courage to Face COVID-19, written with John Leake, approaching 1,000 5-star ratings on Amazon. And it tells the story of the suppression of early treatment. It's written as a true crime novel. You know, it's not a medical fact book. It's a true crime novel. It's gripping. Tells how I became involved with the White House, the Senate. How did I set all the records on Joe Rogan? What was happening in France with Didier Rialt? You have to read it. Steve Bannon was right. We got to get all the books. Naomi Wolf has got a terrific book, Bodies of Others, Robert F. Kennedy, The Real Anthony Fauci. There's about a dozen or so books. The reason why they're so important to get physically is because the electronics are going to be corrupted. If they're not, Google is corrupted. The Wayback Machine is corrupted. All the social media, as this gets worse and worse, will be corrupted. The only thing that's going to stand is the printed word. So thank you so much for having me on this program.
Thank you for being with us, Dr. McCullough. Have a great day.
Thank you.